Hi, my name is Tim Luckett. I'm a registered nurse. I'm the administrator and director of nursing here at Advanced Diagnostic and Surgical Center in Alhambra, California. We were just named into one of the top 400 surgery centers in the United States and the top 55 surgery centers in the state of California. We've been in business for 17 years. We do all types of surgeries here, including general surgery, gallbladder removals. We do gastrointestinal surgeries, upper and lower colonoscopies. We do some gynecology, and come with me and I'll take you on a tour of our facility. When you come into our surgery center, since the pandemic of the COVID-19 virus, the first thing you'll come to is this station where a paper is filled out asking you questions about your past medical history, and also your temperature is taken. Anybody with a temperature of 100 or greater is turned away because that's one of the symptoms of COVID-19. So when the patients come from the COVID-19 screening desk, they come over to the front desk, which is where the paperwork is generated for their surgery. Most of the paperwork has been pre-prepared so that there's a minimal amount of waiting. Once the patient has done the paperwork at the front desk, they come through the door here and they're put into the pre-op admitting area. Here they're asked a series of medical questions from their past, and they can talk to the physician if they'd like to, or we answer any questions they may have. This is one of our GI rooms. GI stands for gastrointestinal, where we do endoscopies. We use the best equipment available, and we have two machines that, once these devices are used, that clean and sterilize the scopes between patients. This is the endoscopy cleaning room. Once the patient has been examined with one of our scopes, they're brought in here, they're put into the machine. The machine, through a series of detergents, washes and decontaminates them, and they're hung up into a closet and they're ready for the next patient. This is operating room 2. Once the patient is admitted through the pre-admission process, they're brought down to the room on a gurney, brought into the room, put on an operating room table. They're prepped for surgery. The surgery is completed. They are awoken, taken to the recovery room, which is just across the hall. This is the post-anesthesia care unit. Post-anesthesia is also called PACU, P-A-C-U. Once a patient's procedure has been completed, they're brought via the stretcher into this area. We have 8 beds here. They're cared for until their anesthesia wears off to the point where they're safe to go home. They are also picked up from their relative or their ride from this area.